Okay, guys. Now I'm going to talk about the thiopentone sodium. So basically, it is we use it for the three things. So first uses we will see. So we use for anesthesia, though it is poorly anesthetic. So we use for anesthesia, and we use for convulsions. So it is used for as a anticonvulsant drug for convulsions we use, and we also use it for the narco analysis in narco analysis. Yeah. So before moving ahead, I'll be um, will be telling it mnemonic about the adverse effect of the thiopentone sodium. So yeah. So here I'll be discussing the. Let me change the color of the pen. Yeah. So I'll be telling the adverse effects for mnemonics for the adverse effect is the Marav G. So mnemonic is Marav, Marav. It is a name of a boy, and G. G we give usually we use for as a respect to someone. So we use Marav G. So adverse effect. So can I erase it now for now? I'm sorry. Oh, yeah. So can I write down here Marav and G? Yeah. So let's change the color again. Which color? Okay, violet. Yeah. So M stands for the muscle relaxation. So muscle relaxation or as a muscle relaxant. Okay. A stands for the acute intermittent purpura. Acute intermittent purpura. First I'm just writing down mnemonics and their meaning. So afterwards I'll be explaining it too. Are for the respiratory distress. Respiratory distress. Again, A stands for the analgesic. Analgesic. That is what we are using. No, it's adverse effect and it's disadvantages. So both combinedly we are using. So disadvantages we also learning it from the same mnemonic only. And V stands for the vasomotor depress. Vasomotor depress, and G stands for the gangrenes. Oh wait, yeah, gangrenes. So the mnemonic is the Marav G as the adverse effect of the thiopentone sodium, which is usually anesthesia, and we also give it for for convulsions. We also give it as a in narco analysis. So yeah, in adverse effect I have made a mnemonic that is the Marav G. M stands for the muscle relaxant. A stands for the acute intermittent purpura. R stands for the respiratory depress. A stands for the um, analgesic. V stands for the vasomotor depression. J stands for the gangrene. So whatever is there, na, it is like low only, like low or poor. So it is either low or poor. So it is low or poor. So yeah. So disadvantages and adverse effect is that it is poor muscle relaxant. It is it cause the acute intermittent purpura. So it is contraindicated during the in patient which is suffering from the purpura, and it is causing the respiratory distress. It is it is, as I have told earlier, it is poor anesthetic. So it is one of the disadvantages of the thiopentone sodium. Either the good anesthetic agents like inhalational anesthesia anesthetic agents like halothane, or the ether we can give, halothane we can give, and the better we can give is the like nitrous oxide, which is the laughing gas. So that we also can give. Yeah. So now come back to the topic. V stands for the vasomotor depression. So it also causes the vasomotor depression. And G stands for the gangrene. So it also causes the gangrenes. So this is the adverse effect and the and uses of the thiopentone. So I hope guys you liked it. So if you have liked this video, then please do subscribe to my channel. Thank you so much.